Greetings and welcome to another lecture in psychopathology. This particular lecture is covering the big kahuna of this particular chapter, and that is Alzheimer's disease. Now, Alzheimer's disease is the most common and almost certainly the best known of the various neurocognitive disorders. It's a progressive and fatal neurodegenerative disorder. This means, well, neurodegenerative is named exactly what it is. The neurons in the brain degenerate. They fall apart. They die. It is progressive in that it continually gets worse. It does not stall. It doesn't stay still. It just gets worse. And it is pretty much invariably fatal. People may not always die from the Alzheimer's disease itself, but it very often is a contributing cause, at least in part because it tends to show up in the elderly. Now, what most people know about Alzheimer's disease is that it's a memory disorder. That's a problem with memory. The thing is, it's not just memory. Memory is perhaps the most obvious of the problems, but there are all sorts of other cognitive deficits and problems with thinking and such that go along with this particular disorder. Granted, it does tend to hit the temporal lobes first. And the temporal lobes are involved in, among other things, memory, including the hippocampus. Now, the hippocampus are not technically in the temporal lobes, perhaps they're very near it, if not in it. And the hippocampus, of course, is involved in memory. So as the hippocampus goes, so goes a person's memory. You can also wind up with various types of delusions. These delusions may be delusions of persecution. They may think that everyone is out to get them. And this can be a real problem when dealing with people with Alzheimer's disease. Because very often, particularly these days, people with Alzheimer's disease are still pretty physically healthy. And there have been cases, for instance, of people with Alzheimer's disease actually attacking their caregivers, which often are family members. They don't recognize them. They don't know who they are. They're freaking out. They're certain everyone's out to get them. And this can indeed and is a problem, along with jealousy. That's probably going along with the persecution. They get jealous. They think that, their spouse is cheating on them. They think that people, it's not generally a good thing. Most cases of Alzheimer's begin after the age of 45, and 45 is actually pretty young for it. We're learning more and more that there may be signs in the brain in the 40s that something is coming, even if the person is not yet showing the actual cognitive symptoms of Alzheimer's disease. Our brains can actually deal with a lot and can work around things. The problem with this, though, is that it is progressive, which means if it just got, a little bad and stopped, people might not have a problem with it. But it just gets worse and worse and worse and worse. And indeed, there is no cure or a real treatment. Most of the treatments that we have for Alzheimer's disease are what are called palliative. And basically, in the traditional sense, that's keeping people comfortable. So putting them in a setting where their needs are taken care of, where they can reduce the delusions, reduce the negative emotion, reduce the attacks, that sort of thing, and trying simply to keep them happy and healthy as long as possible. Now, I will talk a little bit later, I think, about possible treatments. There really is no treatment. There are treatments that can slow down the progression of Alzheimer's, but there's nothing that can stop it or reverse it. People who are diagnosed with Alzheimer's tend to die around 6 years after they've been diagnosed. However, I just want to point out that that is not after they contracted the disease or developed the disease. That's after they were diagnosed. There's a distinct possibility that that brain neurodegeneration that's been going on has been around for quite a while. It's just that it wasn't bad enough there until it gets diagnosed. It's probably been going on for a good long time. Now, the prevalence, rather like Parkinson's disease, the older you get, the more likely you are to develop Alzheimer's disease. In that once, I believe it's around the age of 85, roughly half of the people that make it to 85 will seriously begin to show signs of Alzheimer's disease. And the younger, the fewer signs that there are. Women have a slightly higher risk. Now, it's slight, and we're not sure why. We're not sure why if it's hormones. We're not sure if it's, like what else might be going on. Use it or lose it. Women are maybe less likely to keep their brains active. We don't know. What we do know that might be a factor is that loneliness does seem to contribute to Alzheimer's disease. And so what might be going on here is simply that women tend to live longer than men. Women are much more likely to outlive their spouses, and women are more likely then to be lonely as they're in their elderly years. And so it's possible that that loneliness indeed is a factor in the fact that women develop Alzheimer's slightly more often than men. Other risk factors include things like smoking. People who smoke are more likely to develop Alzheimer's. People with less education, lower income, lower occupational status. This might be that a protecting factor. There's some evidence that actually keeping your brain active is a protective factor. And it's quite possible that people with less education or who have lower incomes and work perhaps jobs that don't require to use their brain very much, they may be somewhat more likely to develop Alzheimer's than people in other situations. There are other things, long-term use of benzodiazepines, tranquilizers, history of head trauma, obesity can be linked to Alzheimer's, diabetes, inflammation in the body, which is also linked with heart disease, and also linked with obesity and diabetes. So there's a number of possible risk factors other than age, but age really is kind of the big one. When we look at causal factors, it does look like that there's sort of a difference between the people who develop the disease younger and the people who develop the disease older, rather again like Parkinson's disease. People with early onset Alzheimer's, which tends to show up in people's 30s, it's only about 1 to 2% of the cases, but in many ways it does seem to be much more genetic than the later onset cases. And there has been some evidence that there is a gene on chromosome 21 for APP. It's an autosomal dominant. Autosomal means that it's not on the sex chromosomes. It's on one of the other chromosomes. And it's dominant, rather like Huntington's disease is a dominant gene. So it's possible that this may indeed have cause a vulnerability to Alzheimer's. It doesn't seem to be as cut and dried as it is with Huntington's in terms of you have the gene, you're getting it. But it does seem to be a contributing factor. Most cases, however, are what are known as sporadic, in that there is no family history of Alzheimer's, it just occurs. Now, another allele is the APOE-E4 allele. It's on chromosome 19. It does seem to enhance the risk in a big, big way for Alzheimer's. And indeed, if you've taken one of those 23andMe or Ancestry things, DNA tests where you spit in the little tube and they analyze your DNA, they do tell you whether or not you have this particular variant, which is one of those things you may want to decide whether you want to actually know it or not, because at this point there really isn't anything we can do about it. Now, we're not sure that this is dominant. It may be codominant, which means that if you have 2 of that gene, yeah, you're pretty much, in trouble. But if you only have 1, then the normal gene may moderate it a little bit. What's interesting with this is that people with this allele, their brains are not very good at clearing a particular protein called amyloid protein. Amyloid protein is produced simply by the brain surviving. I mean, it isn't something that is introduced into the body or something that is weird. Our brains seem to produce amyloid. It's just that in people with Alzheimer's disease, they have too much of it. So whether their brain simply is not good at clearing it, or they produce too much, or whatever might be going on, we don't know. But it does look like this gene is involved in clearing amyloid protein, and therefore this variant may cause the clearing to be less efficient. Alzheimer's is most common in people of African descent, people whose ancestors originated in Africa. The next most common is people of European descent, and least common is people of Asian descent. Asian, I presume, Native American descent. The neuropathology. What is going on here? As I mentioned before, we know that amyloid plaques are involved here. Okay? We got amyloid plaques that are somehow, this protein is secreted by neurons faster than they can be cleared away. So what happens here? The brain cells that are being clogged with this amyloid die. And it also leads to inflammation. We're learning more and more that chronic inflammation is a bad thing. It's linked with heart disease, it's linked with Alzheimer's, it's linked with all sorts of bad outcomes. Now, the thing is, though, we don't know whether this amyloid plaque is the cause or the amyloid plaque is what is being left behind when the brain is defending against other things, or whether this inflammation is defensive, or, I mean, we don't know. There's a lot we don't know. This is all correlation. This is all things people have seen, okay, that we're not sure what's going on. There's also the presence of what are called neurofibrillary tangles, which are made of something called a tau protein. Now, these plaques look like little clumps. These tangles look just like little tangles, little knots of thread. Now, normally tau protein supports axons, but in this case, it's basically just being garbage. It's just sitting around and gumming up the brain. We also see a loss of brain neurons, which may be the source, by the way, of this amyloid plaque and the neurofibrillary tangles. We don't know. But there's a loss of brain neurons, particularly those using acetylcholine as a neurotransmitter. And as it just so happens, the hippocampus and the areas of the brain involved in memory generally use acetylcholine. Treatment and outcome. We cannot replace what has been lost, and by the time Alzheimer's is generally diagnosed. In the olden days, it used to only be able to be diagnosed after death, because in order to be Alzheimer's, you have to have plaques and tangles. And the only way to tell if they were plaques and tangles were in an autopsy. Nowadays, it's possible through the use of the various types of brain imaging techniques to be able to see, in some cases, the plaques and the tangles. And so it's possible to diagnose it a little earlier than death anyway, but still the presence of plaques and tangles means that degeneration has started to happen. So very often what happens is people are trying to treat the symptoms, treat the memory loss, treat the delusions, treat the various problems that are going on. There are drugs, by the way, that are nowadays being prescribed to treat Alzheimer's, not to cure it. Pretty much no treatments for psychological disorders cure disorders. They simply mask the symptoms, like aspirin or Tylenol or Advil mask the pain of a sprained ankle. They don't fix it, they just mask it. And so the same thing happens here. It is possible for some people at least to slow down the decline. It's still progressive, it's still going to go on, but you could slow it down when they are given drugs that reduce the breakdown of acetylcholine. So they're given acetylcholine agonists, reduce the breakdown, reduce the recycling. That can slow down the progression, but it will not stop it. But slowing it down is better than nothing. Nowadays, of course, a big thing is for early detection. And in fact, some have suggested that there be widespread testing for this APOE-E4 allele that is linked with a significantly higher chance of Alzheimer's. And that way we know what people to monitor for, what people to perhaps maybe start giving them these drug treatments much earlier. Also to look at cognitive declines. Although the earlier the cognitive decline, the less noticeable it is. So this would be very precise testing very early on. And again, perhaps then with drug treatments, which this is found early, it may be able to be slowed down. But at this point, as I said, we have no way of stopping it. We have no way of preventing it from happening. So in this case, keep your brain as active as possible. Don't smoke. Try to lose weight. Try to exercise. Are about the best that we can do.